program at Augusta University Children's Hospital, Georgia. And she's going to talk to us about the program internship. All right, welcome. We're glad you're here. So I assume that all of you are in the right place and want to hear about child life, right? And I assume that you want to hear about our AU UGA internship program, right? Okay, go ahead. You can advance the slide.
Oh. There we go.
There we go. All right. Okay, so hopefully you have done a little bit of your homework about what a child life specialist is. Whether you have met one, whether you have seen one, whether you have experienced one, or whether you've just looked it up on the internet and thought, this sounds really cool, like I might want to do this. How do you become a child life specialist? And these are the requirements that are set forth by our professional organization that's called the Association of Child Life Professionals, ACLP. However, if you want to look that up, it's www.childlife.org. And it's still childlife.org, so there's that. They have a great student section, if you can navigate their website, that talks about what you need, what child life specialists do. So if you haven't been on that website, I would strongly encourage you to kind of check that out. But this is kind of the, I guess, the main points of how to become a child life specialist. First of all, you have to have a bachelor's degree, okay? I have lots of people that come up and say, oh, do you get paid to play in the hospital? And I'm like, as a matter of fact, I do. And I have a master's degree in child life, so look at that. And then you help educate them and help them understand. You also have to take 10 college level courses in child life or a related subject. All of this is so you can sit for our certification exam. You're not going to get a job as a child life specialist unless you eventually become certified, right? You don't have to be certified when you start applying for positions, but every employer is going to say you have to be certified in so much time, right? In my program, I say that I can hire you today, but you have a year to become a certified child life specialist. Take and pass the exam. And if I'm looking at your qualifications and you don't have these things, then you're not going to be able to sit for the exam in order to be certified. Take 10, so you have to have those 10 college level courses. And on the Child Life Council website, it spells those out, what they have to be in, right? They can't be in Spanish, they can't be in exceptional child, they can't be in, they're very specific about what you have to have in order to be a child life specialist. You have to complete and I believe that this might be inaccurate. I think that they bumped the hour requirement up. 600. It's 600 hours. I changed it on the other slide, but I didn't change it on this one. You have to complete a 600-hour internship, okay? Your internship has to be done by under the supervision of a certified child life specialist. Now, a certified child life specialist, you can do it in a 1-person program, you can do it in a 100-person program, that's fine. But in order to be signed off, the child life specialist that you are having as your supervisor has to have had 2,000 hours of paid child life experience, which roughly works out to about 2 years of working in the field. The reason why they do that is because, hi, I'm Susie. I just got a job as a child life specialist. Oh, Susie, here's your intern. Well, I'm just trying to figure out my way in my field, on my floor, with my diagnosis, what my procedures are with these kids. It's hard for me to teach that to someone when I for sure don't know that yet, right? So that's why they say that you have to have 2,000 hours of child life experience before you can supervise an intern. And then you have to sit for and pass the child life certification exam, okay? So those are the things to do in order to become a child life specialist. I will tell you that internships are extremely competitive, almost to the point of being ridiculous. I have I'm friends with lots of people in the field, and I will tell you that this is a problem everywhere, right? We have programs that have 30 child life specialists. There might only be 2 open internship slots, and people are literally looking at 150, 200 applications for those 2 slots. Highly competitive, right? So that's important for you guys to know, and that's also important for me to say because you got something in your backyard. All right, go ahead. Okay, a traditional internship is usually about 15 weeks, 16 weeks, and 1 school semester, okay? So you go there and you stay for 5 months, 4 months, 3 months, 6 months, whatever. You obtain at least 480, this is where I changed it to 600 hours, and I'll change that on the other slide too. Most places let interns go through 2 rotations, 2 different areas. So you might see the emergency room, or you might see the emergency room in an outpatient clinic, or you might see surgery, or you might see hematology, oncology. You might see just 2 of those areas, okay? So you get really good experience in those 2 areas, which is awesome, right? Because what the goal of your internship is to learn the role of child life and to be able to actually perform it towards the end, right? And you may not see all areas of the hospital. Say you're going to Cincinnati Children's, for example, they have 100 child life specialists. You're not going to go to every one of those child life specialist areas, right? You're going to have your little niche. You're going to get your experience where your little niche is, okay? And you'll get a great quality internship, right? But you'll only be in those 2 areas that you're doing your internship in. Okay. Our internship is a little bit different. Now, the first thing is that it's a full academic year. So our interns come in August and they stay until May. Now, I just want to say that that is a giant commitment. You want to do child life, right? Because you're giving up essentially your senior year here in Athens, okay? Augusta has a downtown, but it doesn't look like Athens downtown. Step 1. Step 2, you're not eligible for those 90,000 tickets that are sold to Sanford Stadium on a Saturday, okay? Sometimes that's a big deal for people. Giving up your senior year in a sorority, let's pretend like you're going to be the president, right? Or you have aspirations to be the president of your sorority. Moving to Augusta, Georgia, you can't be the president of Kappa Kappa Gamma. You're not going to do that, right? So it is a commitment, and it's something that you need to think about and ponder. Are you ready to leave Athens? Okay. Now, if this is where your soul is leading you, if this is what your passion is, that won't be a problem at all, right? Because you're looking at what's going to happen in the next 5 years, not what's going to happen in the next 5 months, okay? So that's important to remember. But I do recognize that it is a commitment to the program, and it's also leaving the classic city, okay? You will get either 5 or 6 unique rotations, and it really just depends. It depends on a bunch of different things. The biggest thing for me as the manager is it depends on my staffing. Currently, right now, I have 1 child life specialist who is newer in the field, and she still needs, I think, 400 hours before she can supervise an intern. So she won't be eligible until January to supervise an intern. So I have to look at my staff mix and decide. Everybody always says, how many positions do you have? How many interns do you take? It really depends on my staff mix. I try really hard, and other programs will let 1 supervisor supervise 2 interns. I'm not a fan of that because I think that it's really important for you to get one-on-one instruction, supervision. And if there's 2 interns, they have to share the experiences with kids. So if you're with me, you're going to go to 1 port access, you're going to go to the other. I would rather have 1 intern and you go to all of them, and then I get you next semester so you can do all of them. So it's more experience, right? This is definitely a field where you're going to do a lot of experiential learning, okay? So that's really important. So you would rotate, and we'll talk in a minute, all the different areas that you go to. In our internship, instead of 600 hours, interns have to complete 1,248 hours in order to graduate. So most interns get far and above that, okay? because they either are involved in our camp programs or they stocked up on hours in a various and a sundry kind of different things. So I would say most of my interns leave with 1,500, give or take, hours. You will see all the areas where child life is present. Okay, so you will see inpatient, right? Upstairs, the floors, kids getting admitted, having to stay overnight. You'll see outpatient, okay? Clinic appointments, kids coming in for allergy testing, kids coming into hemo clinic to get chemo for the day. You will see intensive care units. I have a child life specialist who follows NICU consults. I have a child life specialist who her coverage area is the intensive care unit, the pediatric intensive care unit. So you see critical care. You see emergency room. You will see the epilepsy monitoring unit. You will see MRI sedation. You will see surgery. You'll see all the areas where I have staff, right? Oh, and by the way, I probably need to add, you also will get a facility dog rotation, unless you're allergic to dogs. But we did have an intern who was allergic to dogs, but she begged to do the facility dog rotation, and she just took Benadryl for the week, for those 4 weeks. I don't know if that technically, legally should have been the way she should have gone about that, but she assured me that she wanted to do that and it wasn't that bad. So we went with it because she really wanted to see what that was like and how we utilize dogs in our programming. And we have 2 dogs in our hospital. The last thing is something that I am extremely, extremely proud of. There is, I think, no other program in the country that can boast this. So that's why I try not to give myself pats on the back, but this is something that I give myself a pat on the back about. We have 100% pass rate for the child life examination. And I say that again, 100% pass rate for the child life examination. Now, I always say that and I always repeat that on the first day of internship to put the pressure on everybody sitting at the table who I selected. But it's really important, right? That means we're doing something right. The exam is not only knowledge and what you get up here in your years of teaching and what I teach once you come down to Augusta, but it is also your experiential learning, right? If you don't have a good internship and you don't have a good knowledge base, you're not going to pass the exam, because the exam is a combination of not only knowledge, theory, how coping strategies, etc., but it's also putting you in a situation and you figuring out the best thing to do. And if you didn't have a good internship, then you're not going to know how to answer those questions, okay? And it's purposely set up like that because we want it to be a true competency test to make sure that you not only have the knowledge, but you also know what to do in the spur of the moment, right? And when you walk into a kid's room and something weird and wacky happens, because welcome to child life, where something weird and wacky is always going to happen. That's just the way it is, okay? All right, what is Augusta like? It's not Athens, right? But there's still lots of fun things to do around the city. So this is kind of funny. All of our students have to do a final project. And this is actually a student project. So one of the things that she was really, really loving in Augusta was great cake and the Bull Weevil restaurant, which is the cake over there to the left. So this was the students' last project, was to try to do a recruitment video, right, for the program. Beautiful scenery, I guess she's talking about the canal, and fun holiday lights. There's a lot of things to do in Augusta, okay? There's a lot of students there. We have a medical school, we have a dental school, we have a nursing school, we have a PT school, we have an OT school, we have Augusta University, which is just basically, I guess, up on the hill. That's all the health sciences campus, the people that I just rattled off. Up on the hill is, all of your people that want to be teachers and the academic kind of things. But down on our campus, the health sciences campus, you've got respiratory students, you've got all of the allied health sciences students. So it is very much an academic centered area and an academic centered city, right? Okay. All right, the Children's Hospital of Georgia. This is a picture of the front of it. It looks a little bit different. We now have a logo picture on that little block up in the top left. But we are a standalone hospital that's connected to an adult hospital, right? All of that is Augusta University. We are Augusta University's Children's Hospital of Georgia. We have 2 inpatient floors. We have an intensive care unit. We have a neonatal intensive care unit. And we have children's services in a clinic that serves all different kinds of specialty areas. We're an academic teaching institution, which means we have med students. We also have a variety of students in addition to our child life interns that come. So that whole building is all peds, right? We recently have had aspirations to build another tower that's going to house our stem cell transplant unit, in addition to an expanded neonatal intensive care unit, and more beds for a pediatric intensive care unit. There's discussion about having cardiac kind of kingdom. So we're still working on what that's going to look like. And of course, we have to raise millions of dollars in order to do that. So that's a little bit down the road, but nonetheless, aspirations are growing because this building we've been in 22 years, I believe, and we've outgrown it. So we need more space. We have more patients, which is a good thing, I guess. But we have more services and more things that we're trying to provide for patients in the buildings. Okay, what will you learn? These are the core things of child life, right? You're going to learn coping and distraction. You're going to learn preparation, how to prepare kids for surgery, for stitches, for saying goodbye to their brother or sister who just died. You're going to learn medical play. You're going to learn the administration part. When you're on my rotation, I wear 100 different hats at the hospital. It seems like I'm the manager of child life. I'm also the student coordinator. I'm also the director of a variety of camps. Camp Rainbow, which is our camp for kids with cancer. I'm the director of Camp Sharing Care, which is our camp for pediatric oncology families who have just been diagnosed with cancer. And I'm also the director of DASH, which is our grief camp for anyone who has lost their child to a chronic illness. I also am in charge of budget, big fun. I'm in charge of evaluating my staff, big fun. I'm in charge of, I'm also a secondary dog handler. So Nugget comes with me every once in a while. My primary, I was telling Diane that my primary person that had Nugget had a baby. So I had Nugget for about 4 months. All of which, in good child life style, I was trying to prepare her for understanding that she is a dog, because she didn't understand that. And she was going home to a house where there's going to be a screaming, crying thing that wasn't going away. And this attention-seeking behavior dog was going to have a hard time acclimating to that. And as much preparation as my child life background taught me how to do, I still don't think she got it. And she still was a little undone when she went home and realized that baby thing isn't going away. And that she has 4 paws and a tail, and all of a sudden she's not the queen of the castle. So back to administration though, we talk about statistics, we talk about writing grants, we talk about how to manage a department, how to staff a department, where to put staffing, how to switch staffing up, which has been quite the challenge in COVID times with, clinics closing, and what do I do with that staff person? Census, the adult side came over and took over our whole 4th floor with adult patients. So what do I do with the child life specialist who usually works there? Where do I kick her? Where's our area of need? That kind of fun stuff. All right, pain management is definitely a big thing in the hospital, right? And definitely something that child life can definitely help with. So you will learn about that. Family support. We are a patient family-centered care institution. We want families, except when we're in COVID restriction, to be a part of the healthcare team. Now has been incredibly hard. Not only do we make families wear these lovely masks, but right now, currently, we're down to 1 caregiver in the room. I had a teenage boy who just got diagnosed with cancer Monday. Mom could be there, dad could not. Mom needed dad, right? Patient needed dad. Siblings can't even, not even a thought about coming up. Hard times in healthcare right now, right? Trying times. Now, imagine if that was a teenage boy. Imagine if he was 3 and realizing that mom can't come up. And oh, by the way, once one caregiver starts, we're really trying to limit germs. So we want that caregiver to stay throughout. So they can't trade out. Earlier, we could trade out. Like back in March, April, we were allowed to trade out. But with our recent surge, we've kind of cracked down on visiting hours. Really hard time. So it's interesting because all of the interns from last year are like, we didn't do any sibling activities. I'm like, yeah, because you didn't see it. So right now, it's really challenging for us to keep connected with those siblings and help these patients keep connected with these siblings. But in the real life world, no COVID, we do a lot of stuff with family support and involving siblings in our program. Normalization, of course. Play for play's sake. Pre-COVID, we have 3 playrooms in the hospital and we have a teen space. Those have not been open for almost 2 years now because we're not allowed to gaggle patients together. I was telling Diane earlier that probably about a month ago, like 6 weeks ago, we had this small window where our numbers went down to like 20 COVID patients in the hospital. Hallelujah, everybody having a party. We were so excited. We cleaned up our playrooms, which had kind of looked like storage areas because we've been working out of the playroom. We've been not using reusable toys. We've been giving everybody stuff from donations. We had these giant bins of donations that were just in our playrooms. We were sorting through, making a girl bin and a boy bin, and we were giving stuff to kids and they could keep it forever. Kids love that, right? It was like Christmas every day. Like, let's party. But then we were like, well, our numbers are down. Maybe we can open up a playroom. Maybe we can open it up in a safe manner. Maybe we can have kids sign up for like half-hour increments and they can come to the playroom. We had 2 lovely, glorious days of having our playrooms open. And then all of a sudden the bottom fell out and we were surging again. So we had to close everything up. We had visitor restrictions again, blah, 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 blah. So normalization is important. And now we've had to transfer our normalization that usually happens in the playroom and is usually available in our playroom. And oh, by the way, did I fail to mention that in the past, pre-COVID, our playrooms were open 24/7. You don't have to have a staff person to play. That was never our philosophy of practice. We want kids to play whenever, right? If you get admitted on a Saturday night and your child life specialist doesn't come to work on Monday, why should you sit in your room twiddling your thumbs on Sunday because the child life specialist doesn't work? That's not fair. That's not family centered. Get in there and play with whatever is in the playroom. We've had to translate our practice in different ways due to COVID. Hasn't everybody's life changed because of that? All right. What you will learn is in-depth child development. I mean, you get the basis of that here in your 3 years. You'll also learn that you deal with a variety of cultures, okay? In the month of December, for example, we celebrate many, many, many things, not just Christmas, right? We have several Diwali, Ramadan, Kwanzaa, Hanukkah. We have a multicultural population that we serve on a daily basis. You will learn about common diagnosis and procedures in all of the areas where you will rotate through. You will learn about assessment and how to read a room in less than 2 seconds. If you're walking in and all of a sudden you have met a 3-year-old who's kind of climbing all over the room, and the nurse says we're about to do an allergy test on this kid. An allergy test means they have to lay on their stomach, and the nurse is going to get this little scratcher and put things that they should be allergic to all over their back, like 30 of them. And then here's the extra added bonus. That 3-year-old has to lay still for 20 minutes. Good luck.
And not scratch.
And not right. And by the way, if you're allergic to pine nuts, this feels like it's burning out of your body. So that 3-year-old wants to scratch like heck and they can't touch it. So your job as the child life specialist is to keep that kid occupied, entertained, and distracted. But you have to be able to assess what that kid's going to get excited about and hooked into for the next 20 minutes. Which, oh, by the way, if any of you have been around 3-year-olds, which I'm sure you probably all have at least seen them, that is 20 minutes. That is the longest 20 minutes of your life. That could be almost 20 years, honestly. So there's that. You've also learned flexibility. I'll tell a story about my interns. So this was the first week where they did developmental play groups, which is an activity we'll talk about in a minute. But they were supposed to be doing team night. Well, they got through all of their teen stuff. They plan an activity, and it's for teenagers. Well, the only kids that I had in oncology were 2 3-year-olds. So they had to adapt their teenage activity to my 2 very, what do I want to say, stir crazy in their rooms 3-year-olds. So flexibility is key. That is the first thing that I write on the board when the students come in August. And I point to it at least 10 times during the week when we're doing classes, and I write it on their logs and all of that. What you also will learn death and dying. We have a little death and dying mini elective in the spring semester. You'll also learn about how we do grief and bereavements, how we help kids through that process. This year, a couple of the students were interested. We paired up with the YMCA and did a camp for kids who had just lost a parent. And they were able to, the students, this was an elective thing, but I gave them clinical hours for it. They were able to help with our therapeutic sessions with these kids. This was a growth opportunity for both my staff and myself and the interns. We had never met these kids before. All of our other camps, we kind of know our kids, right? We walked in cold, and these kids walked in and they had people that had died from everything from a gunshot wound to the face that was self-inflicted to the person was at work and got plowed down with the machinery and died, to people who died with COVID. So it was quite the variety of kids and quite the variety of needs. So that was definitely our students this go around, their first experience with death and dying and helping grieving kids. But we get more into that and really, really dig down and talk about what are child life interventions. Not on a daily basis, but I will say as of late, on a weekly basis, we have a death that we are called to help and assist the family with saying goodbye. We do, and we have made some exceptions for siblings to come up, even though technically they're illegally coming upstairs, but this is kind of an extenuating circumstance to come up and help and say goodbye. So we've been working with families with that too. That is a part of child life. A lot of people don't like to talk about that part. It's the hard part, right? The good news is it doesn't happen every day, right? And also the good news is, and this is how I try to paint the picture, is that we are helping families through the absolute worst day of their life, period, end of story. And if we can do that in some little way, that is a gift, right? Like I said, it's not something that we do every day, but it is something that is important and is very much integral to the role of being a child life specialist. Okay, what's administration? I think we talked about most of this. Budgeting, donations, special event planning and facilitating. We're kind of not doing very many special events. In fact, we just had a conversation yesterday about what in the world trick-or-treat is going to look like. Usually trick-or-treat is we dress up everyone, we go all around the hospital, everywhere, to see, to let those kids get candy, and if they can't eat and have diet restrictions, they get toys and all that kind of stuff. Last year, we had a bunch of hospital staff come up to the floors, and all the kids dressed up, and they just kind of stood in their doorway, and the people trick-or-treated. We did reverse trick-or-treating. As of right now, if I were a betting woman, I'm thinking that that's not going to be allowed because we're bringing all the people's germs, even though they're hospital people, I get that. But right now, we're still not allowing dad to come upstairs. So if I was mom, I'd be pretty ticked off if half the hospital was roaming around the hallway giving candy to my kid. So I just had a in-depth discussion with my special event coordinator about how can we rework trick or treat. We still need to dress up the kids, they still need to get candy, but how can we make this work? So we're trying to problem solve. And I think we came up with some pretty good strategies. But another thing of monthly reports, that's part of administration, how you track who you see. Why do we need to do that? Because if my boss calls me down and I've asked for 4 additional positions for the past 4 years. She wants to know who would be able to be seen by these 4 additional child life specialists, right? So then I can show her, this is how many kids were in clinic today. This is how many child life touched. This is how many we missed. Like one of my 4 positions could pick up the slack on all of that and we would get better numbers. We would get more patients seen. We would increase a parent's positive interaction with the healthcare system if their child is prepared, coping, we're giving them something to do, they're not jumping up the walls, that's going to increase patient satisfaction, which will therefore increase them coming back to the hospital because they had a great experience. Their kid had a great experience, even though they had to have something done, a procedure, they still had a great experience, and it was because child life helped. Charting, we chart in the medical record. You'll learn all about that. Statistics tracking, that kind of goes hand in hand with monthly reports. What classes do you take? For the fall semester, you take a medical ethics class. This is a multi-disciplinary ethics class. And recently we have a new instructor. So it used to be just a 6-week class. It's a 1-credit class. It used to be 6 weeks and they were finished. She's decided to spread it out through the entire semester. Student seminar is the child life class, and that is taught by me. Every week we come and we talk about a topic, right? So it's kind of like your lecture, okay? And then the rest of the time you're out with a supervisor doing clinicals, okay? We also do a medical terminology class in the fall. It is kind of a self-study thing and it's quiz. This is so you get the basic medical terminology. So when you're sitting in rounds and somebody says cardiothoracic, you know what that means, right? Somebody says an appendicitis, you know what that means. Then in spring semester, you have death and dying. We do a death and dying elective. We talk about child life interventions. We talk about dealing with SIVs. We talk about dealing with parents. We talk about dealing with kids, right? We're in the business where we help kids understand the whole process of dying as they're going through it. Okay. I have sat before with oncology patients and planned a funeral with them. Okay. That's part of child life. Helping them understand, preparing them for the process, right? Life class, another class. Okay, so pre-COVID, this was an opportunity. Life stands for learning in family environments, okay? So I would take you and say, here, you're gonna be paired up with this newly diagnosed oncology family. You have to spend so many hours outside the hospital with them, learning how this diagnosis of oncology has affected their day-to-day life, okay? We've given an intern a diabetic family, and they've gone to the grocery store and planned a meal and went back with the family and helped cook it and realized how many carbs are in a Cheez-It versus Pirate's Booty popcorn, which is much better for somebody who has diabetes. So it is a learning experience that you were assigned to a family and you would go into their house and learn about how to take care of them. And you'll see some pictures from that in a minute. Post-COVID, right? I'm not going to put any of the interns in with a chronically ill family because they're walking into, as I referred to it to Diane, the COVID crock pot every time they walk into the hospital. We're not going to take COVID to a family. So we've had to kind of adapt that. What did I say? Flexibility is key? Yeah, okay. We also have a cram for the exam little seminar where we teach interns how to study for the exam. Helpful study hints, what our previous, usually we get the person who has taken the exam the last, and they talk about what their study tips were, how they studied, what is good to concentrate on, what is great to review, got to know your theory, got to know this. So that's just been a helpful thing. Yes. So this is live class, and these are some of the families, and these are some of the things that they did. You can go to the next one. Yes, learn what that day-to-day looks like. Yes. So this is another family. Benefits of a year-long rotation or a year-long internship. You got 5 or 6 unique rotations, right? You also have experienced supervisors. Now, all of us do child life in a different way. The good news and bad news of child life is not everybody does it the same. So you get to experience 5 or 6 different supervisors in their style. Like I walk into a kid's room and say, hey, my name's Kym, I work with toys. Not everybody introduces child life services like that. Some people walk in, hi, I'm the child life specialist. I will provide preparation and coping and normalization and distraction while your kid's in the hospital. I'm like, I'm just going to cut to the chase. I work with the toys. We'll get into all that other stuff later. And that's usually how I introduce it to newly diagnosed oncology kids, which are my patients. Walk in and say, yeah, my name's Kym. I work with the toys. What do you like to play with? Oh, and all that stuff, we'll get into that in a minute, like pointing to your IV, pointing to your port, pointing to whatever. We'll get into that later. I want to establish trust. The other piece for me is I have a chronic population, right? I got sickle cell kids. I got thrombocytopenia kids. I've got all the cancer kids. I don't have to do my whole spiel in 2 seconds or less, right? Because I'm going to know these kids for a long period of time. So I can do it in increments versus if I worked on the surgery floor and maybe I'm preparing a kid for surgery, they're going to be here. If they're in for a tonsillectomy, they literally, from the front of the hospital to leaving the hospital, they might be in the hospital 60 minutes. So you got to change your goals, right? So when you observe somebody else, they do child life in a lot different way than I do it, right? You get to see all of that and you'll get to pick parts of, oh, I love the way Stephanie does this. I love the way Harley does this. I don't think that the way Macy does this is probably the way that I would do that with a teenager, for example. You see the hospital in all different seasons. We were just talking about trick or treat. You also see the hospital at Christmas, which is chaos. Holiday, I should call it, which is chaos as far as donations, as far as pre-COVID special events. Everybody and their brother wants to come see the poor sick kids in the hospital in December. Apparently there's not poor sick kids in the hospital any other month, but December is the month because everybody wants to come sing, everybody wants to come to a play, everybody wants to come bring toys, but then they just go away in January. So, right now that's not happening, but pre-COVID, that was something that the interns really liked to see. In addition to all of our camp planning, we have, well, we gained a new one. We now have 5 summer camps that we do. We have 2 family camps that we do. So you get the experience of learning how to recruit not only kids, but counselors, learning how to interview counselors, learning about all the planning that goes into it, the ordering, how you program a camp for chronically ill kids is a lot different than how you program a typical YMCA camp, for example. Let's see, you'll be fully prepared to take the certification exam and you'll have lots of experience with kids and families. All right, so here are all our different rotations, and I'm going to add another one. It will be the float rotation. General pediatrics is an inpatient floor, and she also sees epilepsy kids. Hematology oncology is outpatient in the morning, inpatient in the afternoon, and you see those kids, right? Clinics is we have probably over 300 kids come to clinics every day. So that's a wide variety, from adolescent clinic to NICU follow-up clinic to GI clinic to allergy immunology to general peds to general surgery, cardiology. So you got a whole schmidt and schmatten of just about everything. Surgery is everybody loves to get up early in the morning. You have to be at the hospital at 6 a.m. happy, polypositive, with your smile on your face, because you're preparing some really scared kids who are headed back to surgery, right? The good news about the surgery rotation, yes, you have to be at the hospital at 6 o'clock, as polypositive as you can be, but you get to walk out of the door at 2:30 in the afternoon. So there's that, right? Trade off, go home and nap for a little bit, and then you're an actual person. Emergency room and PICU, right? That is my child life specialist who covers both of those. Great continuity of care. A lot of times she meets those friends in the emergency room and follows them up into the pediatric intensive care unit. So the emergency room, you can get anything from I got a blister on my foot to I just went to my pediatrician. This happened just this week. I just went to my pediatrician and they did my blood work because I've been sick for a week, and they told me I have cancer and they told me to rush to the emergency room. So there's that. To a kid that was in a car accident and watched their mom get her head taken off by the steering wheel and talk to you all about it. So, or a kid that just climbed a fence and put a giant tear in their leg and needs 15 stitches. So the emergency room, and this is from somebody who worked down there for 9 years, is, in my humble opinion, the best place for a child life specialist. Like, it is amazing. It's one of those places that if you are a very planned out person, probably going to drive you batty. But if you like the whatever, roll with the punches, whatever comes in, the wild and wacky, that is your jam. Like, that is the place where you want to be. You're able to see all different areas of the hospital where child life is present.
Is the facility dog separate from that?
The facility dog is a separate rotation, but she covers clinics in the morning in all different areas of clinics. And then in the afternoon, she does referrals upstairs. And then the other facility dog is with my surgery child life specialist. So Casey, yes, happily gets up at 6 in the morning. Unfortunately, Casey also gets up at 6 o'clock on Saturdays and Sundays in the morning because she doesn't realize it's the weekend. But Casey gets up and she comes and prepares kids for surgery. Kids take the anesthesia mask and put it on her, and she does the whole checkup with them and then helps get them back into the room before they go to surgery. So yes, but the facility dog is another rotation, and then soon to be my float child life specialist will be another rotation, and she is my MRI sedation girl. She also covers NICU consults, so the little tiny babies that are smaller than your hand, she's seeing them. And then she also pinch hits in clinics when we need her. So let's see, with the year, okay, you're able to see 3 different seasons and holidays. We already chatted about that. That was Thanksgiving over there to the right. That is Halloween over there to the left. And there is holiday / Ramadan / Kwanzaa / Diwali / all of the December holidays. Who is teaching you? So here are all of my child life specialists. And I also included Nugget and Casey as our facility dogs because they're teaching you as well. So you get a variety of experienced supervisors who will mentor, teach, and encourage you. Most came from the AU UGA program, and you will learn different unique teaching styles, like I talked about.
I was going to ask that, how many of them are from this program?
Macy is a graduate. Meredith graduated from the University of Georgia, but wasn't part of our internship program. Stephanie Grayson is a graduate of this program. Harley is a graduate of this program. Preparation for the certification exam, we kind of already talked about this, 100% pass rate. I just want to say that again, 3rd time's a charm. Cram for the exam session every week during 2nd semester. Weekly student seminars to discuss relevant child life issues. That's class every week that I teach. and daily, weekly preparation through clinical time and weekly work. There is a lot of written work involved in this. There is a lot of readings that are specific to child life. I'm not going to tell you that this is an easy year. If you're looking for a easy peasy senior breezy year, this is probably not it, right? It's a lot of work, but it's all work for a purpose. Everything that you do, every assignment that you have has meaning, and you will understand it. If we're doing assessments, for example, once we start doing chart notes, you'll be like, oh, that's why you had us do all those assessments. It all fits in together, right? We are an accredited internship program from ACLP. What does that mean? That means we cover all of the information that ACLP feels is integral to an internship program, okay? They have a very comprehensive list of all the things, topics, I guess, competencies that an intern needs to have. And we, as being an accredited program, have achieved all of those through our curriculum. It is a lot of work, but if child life is what you want to do, this is a comprehensive way. My goal is always to prepare our interns to walk out the door and get a job doing any child life job. Now, let's say an intern is interviewing for a burn position. We don't have burn patients at our hospital, but I have given them the skill set to walk in and to be a burn child life specialist if that's what they need. Because I've given them all the preparation. They've had critical care, they've done coping and distraction, they've done grief work, they've done preparation, they've done normalization, they've done medical play, they've done therapeutic interventions. They can translate all that skill set to whatever population they're interviewing for. There's a lot of group assignments. You must work well in a team. Group activities, developmental play groups. That just started for this group of interns this week. So every week they plan an infant developmental play group, a toddler developmental play group, a preschool developmental play group, school age, and adolescent. What is developmental play group, you might ask? Well, let me tell you. So you look at an activity, you think about what is the goal, okay, based on development. So I think that their activity this week for adolescents was stress gloves. So they got gloves, they were filling it with cornstarch and some kind of voodoo that makes it kind of squishy. And they were asking the intern, or they were asking the patient to write down what stressed them out on one side, okay? So IV starts, eating those gross eggs every morning. The doctor's coming in every morning on rounds, like that might be something that they read on this side. On the other side, playing a game, having an Uno tournament with mom, getting caught up on my homework with stuff that made them feel unstressed and felt good. So they talked about how you can squeeze the bad stuff, like squeeze the bad stuff away. Their therapeutic thing was feelings, emotional outlet. Okay, that was the developmental goal that they wanted the patients to achieve. So for every week, the students plan developmental play groups. They do them all by themselves. They keep stats for them. We went shopping. I gave them a budget. They had a planning period where they planned all the activities for the entire semester. They came up with a budget. We went to Walmart. They went shopping. I met them at the cash register and said, okay, you got $175. Let's see what you did. And so they take all ownership over all developmental play groups. They have a referral sheet that they came up with. They have to make sure that all of the child life specialists inpatient are giving them referrals. So they take ownership over all of that. We used to, pre-COVID, do a haunted playroom where we transferred a playroom into a haunted playroom. The kids and the interns would do that, right? Decorate it, do all kinds of stuff. And then staff would come in and get scooped by the kids. So a little reverse, a little mastery, a little kids scooping up the staff instead of the staff scooping up the kids. Clearly COVID had something else to say about that. Healthy grandparenting is a program that is run through our School of Nursing. And this is for grandparents who take primary care of their grandchildren. Our students are involved in their monthly support group, working with typically developing normal kids. Now you might say, why in the world would you involve the interns in doing that? It is so you still have your pulse on what a typical 5-year-old should be acting like. Because that kid that's laying in the bed that just got diagnosed with cancer, who is the same age, is not acting like that. So it's kind of a reality check of every month to remember that these kids here should be running around and doing crazy stuff like these kids here, right? Planning a typically developing activity for these kids. Medical Play Mondays happen starting in January, and it's a therapeutic activity, kind of like developmental play groups. It's planned and implemented by the interns. And then other special events, we just threw that in there because they're involved in a lot of the other special events that we have. Developmental play groups, we already talked about that. Medical Play Mondays, kind of already talked about that. Oh, I guess we're talking a lot about that. Play and create, facilitate, yeah. Syringe stuff, parachute masks, just using medical equipment and getting kids familiar with it so it's not as threatening as it could be. Healthy grandparenting, we already talked about that. We can go through. Haunted playroom, it's like that's one of the pictures from the haunted playroom. How awesome is that? Yeah, so like we take the hockey table and it's usually a kind of like a grave site for a big giant Elmo, and that's kind of fun. We talk about camps, be a part of the AU camps, be a part of staff recruitment, coordination, working with kids at the camp, especially sharing care and probably Dash.
You do weekend? Or is it all
Yeah. Well, we have 2 week-long summer camps, and then we have 2 weekend camps. And last year during the epidemic or the pandemic, because why not, we started 2 whole new camps. So I don't know what that's going to look like this summer. We'll see. What's next? Okay, let me look at this first one. Everybody read that. Shadow a child life specialist for at least 8 hours. That has previously been one of the qualifications and one of the stipulations for this. Given COVID, nobody will let you come in and watch them. Okay, so I am waiving that for this year. I was hoping I didn't have to say those words out loud and ask Diane. I've been dragging my feet until the very last minute. I made some calls around and not many places will allow. Apparently there are a couple. So I would encourage you. I think that you will definitely have a leg up if you've been with a child life specialist and you really understand the role. I will tell you that you are interviewing for a coveted position. So when you walk into that interview, my expectation is that you have done your homework. You know what a child life specialist does. I will tell you, many, many moons ago, we had an intern who came, committed her entire year to coming to Augusta, right? Had an apartment, a place to live, gave up her stuff here in Athens, the whole 9 yards. You guys know all of the logistics involved in that. Moved to Augusta, walked into the hospital the first day, and she said, I hate the smell of the hospital. Okay, well, let's, see if we can power through, right? Like, let's see what you think about on Friday. Friday, she came to me and she goes, I can't do this. I hate the smell of the hospital. I can't change the smell of the hospital. And quite frankly, you're asking, you are committing to saying you want to be a child life specialist. Most child life specialists work in a hospital environment or in a clinic environment. And, oh, by the way, she was only in the front lobby. Like, she wasn't even in the depths of the ER where you can smell a good smell of diarrhea and vomit at any given time, right? So if that is the case, then you don't need to be here, right? So I'm sorry, you got to pack up all of your things and go back to Athens, finish up your child and family development degree and be a happy camper, because I can't change the smell of the hospital, right? So I'm asking you, shadowing a child life specialist was for you to get a realistic idea of what a child life specialist does, right? Hanging out with them, smelling the hospital, hearing a kid scream bloody murder, that kind of thing. Just making sure that you understand the scope of what you're doing. in what you're saying that you want to do and what you're raising your hand to do and commit to for an entire 8 months and senior year of your academic life.
Yeah,
Right.
didn't you once have a student who also got upset when a child had their blood pressure taken?
Yes. She didn't like it that the kid was crying when we did their blood pressure. Okay, we're not going to change that, right? Like you need to realize that, yeah, you know, some days we come in and think we have a cape on, but we're not going to change everything. Kids are still going to cry in the hospital, right? If you're getting a spinal tap and you're getting a needle that's this big in the middle of your spine, it's going to hurt. You're probably going to cry. But then we also learn that crying is coping, right? So there's that. But it is important that you know what you're getting into. And that's why shadowing a child life specialist was so important. And that's why it was really hard for me to say, no, nobody will let you shadow. I won't even let you shadow. So it's hard for me to enforce a law that I can't even do at my institution, right? Get as much experience with kids as you can, both well and sick kids. You need to fill out the application that is due on November 1, right?
I have a handy dandy checklist for anybody who's planning to actually apply. It does still say that you need to include a letter saying this is shadowed. You can draw a cautious X through that.
Yes,
part.
and I will realize that I'm not getting that. So
My other recommendation for anybody who's planning to apply this year, if you are not able to shadow a child life specialist, do your research carefully. Make sure you have been on the Child Life website and studied it carefully and know things. Watch videos if you can. And
absolutely.
anything else you can do to be sure that you're really clear on what this field is. Because I feel sure Kym's going to ask tough questions about your understanding of the field once you.
That is accurate. Speaking of the interview, then I will come up in November, a date to be determined, and I will interview the people that are applying for the program. And then you will hear.
So when do you notify?
Usually I've been asked to notify after final exams. So usually it's the week after final exams is when I sit and do my final evaluation and do my acceptance letters. So that's mid-December. Mid to late December.
So if you apply this year, you will come back for spring semester knowing whether or not you got it.
Correct.
Because that may influence what class, if you did get in the program, it may influence what class.
Correct.
What are there classes that are needed to be completed for this program? And what are they?
Well, you have to do the 10 courses from Child Life Council. I will tell you that like death and dying, hospitalized child life interventions,
2 child development classes,
And-
research class.
a research class, those are pretty much, those will get you set on your way. As far as requirements, in my head, hospitalized child is essential. Death and dying is pretty important too, and child life interventions is essential.
If you are considering child life in any way, whether this is the program for you, whether you want to go another path in terms of child life, you need to be sure that Julie Patterson is your HDFS advisor, because she is the one who stays on top. But Ahmad is a great advisor as well. But you need to be sure that Julie Patterson is your advisor for child life, because she works with me and makes sure we stay on top of exactly what you need, how to sequence it, how to make sure if you're going to Augusta next year that you get the courses you need in the spring and all of that. So those are good questions to ask during your advising.
So you need 30 hours of classwork here. You need a cumulative GPA of a 3.0. It has to be your cumulative and not your overall GPA. Okay, the next one is waived, right? You're shadowing. Preferred to have taken or been enrolled in the hospitalized child class. You have to have a transcript and 3 letters of recommendation. One of those is an academic letter, and it cannot be written by Diane because she is involved in the child life program. So to take out her bias, it has to be of another instructor for your academic. Does that make sense? Okay.
And what you want from that is to see, can the student handle the academic? Right?
Correct. So it's a lot of academic work and clinical work. It is like going to school full time and then still doing all of your clinical stuff. So it's like having a job and working. Now, all of it is related, right? So when you're doing your academic work, you're writing a procedural observation about the IV that you just helped a kid get through. So it's all related, nothing is extraneous, work for work's sake. But it is cumbersome. So,
Who do you want those other recommendations from?
not your mama, not your aunts, not your grandma. I need it from somebody who's maybe seen you work with kids, right? If you work at Chick-fil-A and you demonstrate good working skills, patient, like public relations kind of stuff, you're talking to people all the time, that's important. If you have nannied for a mama who has an autistic child and 3 other kids and you've watched them, that's fine. That's perfect. That speaks to your experience with special needs kids. That speaks to your experience with typically developing kids. If you babysat somebody for 1 day for 2 hours, that's probably not a strong letter of recommendation, right? If you work at Bath and Body Works, that might also speak to your public relations kind of stuff. But if you work at the Y teaching tennis lessons, that's a great one because you're not only in a leadership responsibility, but you're also working with kids and helping explain things to kids, which also translates to child life because you're helping explain things to kids in the hospital. Does that make sense? Anybody have questions about that? Okay.
And the transcript can be unofficial.
Yes, unofficial.
You don't
So
have
you
to,
don't have to pay.
you don't have to pay the money to get an official
No, no,
transcript.
no.
You can.
And I trust that you're not going to mess with it. If accepted, you need to get ready for a challenging and fun internship experience. And there is my email address. Should you have any questions as you walk out this door going, what did she say about that? Or she didn't talk about that or whatever. It's kyuri@augusta.edu. Please feel free to contact me should you have any questions. And I think, is that it? I think that's the end of my presentation.